Cystic fibrosis is an inherited disease that affects many parts of the body. There are infectious complications in the lung that are probably the most profound effects and ultimately lead to respiratory failure, and many of these patients do go on to need a lung transplant. But there are other manifestations as well, and the most common ones involve pancreatic insufficiency causing diabetes, for instance. There's a lot of gastrointestinal manifestations where weight loss is a common feature. There's sinus infections that occur frequently, and patients struggle a lot of times with various forms of sinusitis. Traditionally, cystic fibrosis has been diagnosed over the years at birth, but we're finding more and more that there's unrecognized disease. So now the diagnosis can really happen at any age, and in fact, most recently we've been diagnosing people in their 50s and sometimes even in their 60s. I think the cystic fibrosis field has changed over the years as the survival has increased. We now have more patients that are over 18, say, at our center than we do that are under 18. Treatment plan for any adult patient with cystic fibrosis is complex. One of the real problems in cystic fibrosis is there's a mucus accumulation within the lung, and the patients aren't able to get rid of it, and it's blocking the airways. What a lot of our effort is directed at is getting those thick secretions out of the lung, and we have a variety of ways we do that with respiratory therapy. A lot of our efforts are directed not only at IV-directed intravenous antibiotics, but also at inhaling antibiotics directly into the lung. And that's been a relatively new development in cystic fibrosis, having taken place in the last decade or so. One of the most important things that we can do is treat the other manifestations of the disease, and that's where our multidisciplinary team comes into effect. Having an adequate body weight is essential to maintaining lung function, so we're very involved with a nutritional team that helps our patients maintain their weight. Another thing that affects lung function directly that our adult patients struggle with is diabetes. And so we work closely with an endocrinology team that actually comes to our clinic to help us manage the diabetics. Although some of our patients come to us at age 18 with normal lung function essentially, many have about a quarter of their breathing capacity when we see them at age 18, and those patients almost certainly are going to require a lung transplant. So we here at Stanford that manage the cystic fibrosis population also manage the transplant population here. And so we can seamlessly transfer patients from an adult CF care mode, if you will, to a transplant care mode. So much of the care is non-physician care in cystic fibrosis, so we need very good respiratory therapists, which we have. We need very good nutritionists. We need excellent endocrinologists to help manage the diabetes. We need social workers who understand the social impacts of having this disease. And then finally, I think it's also important that we have a very strong nursing team that understands this patient population extremely well, and I think we've got that in place now.